Hi, I'm Nicole Jacinto. Join us on Healthline with 𝗛𝗶𝗁 as we discuss the latest health and medical topics with doctors from 𝗛𝗶𝗁. For a healthier and uplifting lifestyle, tune into Healthline with 𝗛𝗶𝗁 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗛𝗶𝗁 every Monday from 5 p.m. to 6:30 p.m. airing on Sky Cable Channel 224 and on all DTT boxes, simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗛𝗶𝗁 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗛𝗶𝗁. Thanks for joining us on the show. It's December 18. Next Monday is Christmas Day, and we will have a new show for you. Yes, we are not doing replays for Christmas Day and New Year's Day here on Healthline with 𝗛𝗶𝗁. So don't forget to tune in next week on Christmas Day and on New Year's Day as well. That way you can get more information that is relevant, actually, not only to your overall health, but how it is impacted during the holiday season. Well, today we're going to talk about sinusitis, and I think that might be a good topic for the time now. And on our show, we have with us Dr. Paulo Catindic. He's an otolaryngologist, or simply, I mean, for us, we got used to saying ENT. Isn't that right, doctor? Welcome to the show.
Hi, Nicole. Good afternoon. Good afternoon, everyone. Yes, ENT po. To be short for everyone, just call us your ENT.
The auto would be the ear.
Ears.
The laryngologist, the throat.
The throat.
Or okay.
The rhinolaryngology.
No, yes. Sorry, I forgot the rhino. Rhino, the nose, like the rhinoceros. Yeah, ganun. Okay. Thanks, doctor. That way people will be like, bakit nga kaya nila pinalitan yung pangalan? Well, it's because that's really what it is. But for people like me who would prefer to shorten, ENT is okay with it.
Yes.
It's not offensive or anything. Nowadays, we don't know. Okay. So, doctor, the topic is sinusitis. Okay. Can you tell us just in brief, overall, we'll get to all the nitty-gritty, of course, overview of what sinusitis is. So, what is sinusitis?
So, in general, sinusitis, rhinosinusitis in general, is the inflammation of the lining of the nose together with your paranasal sinuses. So basically, your paranasal sinuses compromises your maxillary, both your cheeks, the side and cheeks, the one inside your nose, your ethmoids, and basically the frontal, sa taas ng forehead, and then at the back of the nose, there's what we call the sphenoid sinus. Now, there are many, kumbaga, there are 5 basically sinuses, and it gets inflamed together with your nose, kaya siya tinatawag na sinusitis.
Okay, that's great, doctor. And since you mentioned the different parts and where the sinuses are located, maybe we can just repeat that so that people like me and the viewers and those listening will understand more that these are we have it located basically in our facial area, and what are their functions, if you don't mind.
Your area here in the cheek, there's what we call the maxillary. That's why patient who had sinusitis or infection or inflamed sinuses would complain of heaviness ng face, or minsan forehead, your frontal sinus also. Basically, the function of these sinuses, it's air-filled cavity. It makes your head light. Kumbaga, wala siyang laman. It also functions as a cushion. Kumbaga, if there's any impact, yun ang magiging cushion sa loob sa mukha natin, as a barrier for any trauma.
Thank you, doctor. So, the sinuses, because some people, I remember, actually I had sinusitis when I was younger, so I will reveal that. I probably still have it. I think you were seeing me like, you blow my nose right before the show. So anyway, the sinuses are they glands? They're glands. I'm sorry. Just please jump in.
It's actually a cavity lined by a mucosa that produces a mucus to protect your face bag, from any bacterial invasion. It serves as a cushion, to make it light yung head natin. Hindi siya full bone, compact bone. Kasi isipin natin na if your cheek is butong-buto, ang bigat niyan. So, the amazing thing about your sinuses, it's air-filled. Kumbaga, hangin siya dapat. So, to make it light, no?
Yeah. And okay, so that's great kasi I think a lot of people take for granted how important the sinuses are. And we might think, hindi, nasa ilong lang yan. But it's also in your cheekbones, and it's important to make your head lighter and cushioning in case there's an impact, as you said. And then also like in our forehead.
Yes,
No?
yes.
So, okay, doctor, great. Okay. Is talking about sinus like do you get more cases this time of the year?
Yes, actually, we should not interchange rhinosinusitis with allergic rhinitis. Most of my patients would tell me na, "Uy, doc, may sinusitis ako." But when you look into the history and when you interview them, lumalabas pala, it's more of allergy related, though it can be interrelated to one another. When I say interrelated, your allergic rhinitis can actually aggravate your sinusitis.
Yes. Like, okay, so if you have an allergy and it's manifesting like in your nose for inhalants, let's say dust, no, or whatever it is, paputok na ganyan, or anything you're allergic to, could be the pollen or whatever. It can aggravate your sinusitis.
Sinusitis, yes, correct.
Thank you for saying that they're interrelated, but we should not mistake it. Kasi, as you said, like some patients will go to you and then they'll say sinusitis, pero may allergy na rin pala. But you're very equipped to deal with both, right? Yes. Okay. So you can tell the difference as a doctor, as an ENT especially. So if I would urge people, if your nose area or you think it's an allergy or sinusitis is really bothering you, to go see an ENT. I should do that also. Okay. Yun yung mga guilty, ting, ting, ting. So, doctor, okay. What are the you mentioned early, like you said sinusitis. So there are different types of sinusitis, and if there are, could you tell us about them right now?
Basically, there are two categories of sinusitis. We classify them either as acute sinusitis or chronic sinusitis. Basically, they would have the same symptoms such as nasal congestion, obstruction, loss of smell, facial pains. But the primary difference is the number or the timeline. Usually when we say acute rhinosinusitis, it's just less than 12 weeks. This is according to the EPOS guidelines or the European paper, no? And then when we say chronic, then more than 12 weeks of the symptoms.
Okay. So there could be a condition of like more than 12 weeks. Do you find patients who like it just keeps coming back or recurring, like it's almost
Every
a
now and then. Yes.
Yes. Okay, thank you, doctor. You did indicate the symptoms that for sinusitis, which would be nasal congestion, maybe sometimes even a loss of smell, kasi
Yes, anosmia, yes. Loss of smell also.
pain in the face.
Facial pain. At times, patient would have fever also, no?
Pag may infection na rin yun.
Yes,
Talaga.
if may infection, you can have fever also.
Okay. So, doctor, what causes sinusitis, or what are the potential causes of sinusitis?
So basically, for your sinusitis, by literature, it's viral talaga, no? It's viral infection. That's why we discourage patients, to buy over-the-counter, and there's no really over-the-counter antibiotics. Most of the time, it's really viral in nature. That's for acute, no? For acute sinusitis, that's really viral. Kaya we tell them to, you can actually yung self-medication, yung mga self-supportive medication, you can actually do it at home, like yung pag-inom lang ng yung mga tsaati,
Mhm.
simple nasal douching, nasal decongestants that you can buy over the counter. We prefer you taking it rather than taking immediately some antibiotics.
Yeah. So, okay, for an ENT and you're a specialist, if it's acute sinusitis and maybe like, it's viral, it's usually viral.
Yes.
I'm just repeating so I can understand. And then also like if I say anything that's wrong or whatever, please jump in and correct me
Hi,
anytime.
of course. Yes, yes.
um, syempre some people will go, kasi I think we're kind of used to that. Oh my God, sinusitis, and then it's really bugging me. Um, like when I was younger, I was given antibiotics for my sinusitis. So, someone like me who has that experience, so my thoughts would probably go there. Kailangan na nito ng antibiotics. But if we see a doctor like we would know like baka this is viral. It's not a bacterial infection.
Well, again, Nicole, again, sabi ko nga, it is the most common, the viral infection, But, syempre, when we see the patient, may kita na namin, when we do our inspection of the inside of the nose and we see purulent discharge already, may
Yeah.
nakikita ka ng nanang lumalabas, then more likely it's acute bacterial. So we start antibiotic treatment. But it's best that before we start any, lalo na in particular ako sa antibiotics, to avoid any drug resistance, you
Yes.
should consult your doctor to confirm if it is really kumbaga, bacterial in nature. Kasi if we self-medicate with an antibiotic tapos hindi pala bacteria, so yung added expense on the patient, and number two, we're risking of antibiotic resistance that might need a higher form of antibiotics that we need to confine you and give you the antibiotics through IV, and we don't want that.
Okay, doctor. Let's go through two of the things that we just talked about. One is okay. Can you tell us again how to self-care at home? As you said, drinking cha or tea, something to soothe your.
Hydrate. It's more of hydration, so to increase your fluids. Some would tell, some of my patients come, Doc, would herbal teas would help, like yung mga lemon ginger tea, Doc, yung mga salabat, can it also improve? Of course. There are benefits also of taking herbal supplements. Then you can actually start taking your oral over the counter decongestants, mga nasal decongestants na nabibili mo sa mga drugstore. Then yung self-douching, yung paglilinis, yung neti pot, yung paglinis ng ilong, you can actually use it already.
Let's describe the neti pot for our listeners so that and viewers so that a lot of people aren't aware of the neti pot or how to douche. So this neti pot, are there other types of kind of devices aside from the
Meron, there is one available sa market that is already on a bottle form that you can actually prepare at home, no? But at times, yun nga lang, it's kind of messy when you do it. Kaya most of my patient doesn't want it.
yeah.
Yung simple form of sodium chloride sprays will be okay already as a simple way of cleaning your nose, actually.
Okay.
But yung iba is naghahanap ng, Doc, meron ba tayong pwedeng DIY to nasal irrigation that we can do at home? Actually, before, during my training, we recommend using yung mga ketchup bottles. You can, makikita niyo sa mga tindahan, yung mga karinderya style na ketchup bottles, yeah. Then you can actually put a solution, simpleng 1 liter of water, mix it with 1 teaspoon of salt and baking soda, you shake it, yun ang pang-irrigate mo sa ilong, you can actually do it. But
Sorry, go ahead, doctor.
but if you're kind of hesitant, Doc, baka malunok ko, so best na go to your doctor, have then yung instruction can be given to you para magawa mo siya. Breathe, ang lagi ko sinasabi, breathe through your mouth when you do it para hindi pumunta sa daanan ng hangin mo yung tubig.
With things like neti pots or equipment or yung mga DIY, basically, it's a solution that they should get from a doctor like you na it's water, salt, and baking soda, basically. And then you flush your nose, no? You put it up one nostril and then you press or whatever it is. And then as you said, good tip, breathe through your mouth para hindi
Breathe through your mouth, yes, para hindi malunok.
the rest of the mucus will come out through the other nostril.
Yes.
Okay.
Makikita mo, lalabas talaga siya.
Talaga guilty rin, tinamad rin ako. Hindi,
Di
parang
ba?
guilty, ting ting. And then the other thing you mentioned is that there are solutions na that you can buy.
Right.
These are just basically like saline sprays, like water and salt, ganon, that you.
Yes. Almost of the same component. We don't recommend using plain water. It's masakit. Don't try it at home that you use plain water to irrigate your nose.
Yeah.
It's kind of painful when you use it.
Yeah. And don't use hot water. Baka naman isip, ay sige, ganun mo, sunog na pala yung ilong mo. Okay,
Yun,
Doc.
yun lang ma'am, additional lang for the viewers. When you prepare your solution, it's the solution is viable only for one day. After
Yeah.
1 day, gawa ka na ng bago because for bacterial contamination. Baka instead na makatulong sa na gumaling yung sipon mo, nagka-infection ka pa lalo kasi yung ginagamit mo lagi yung same solution. So make a new one every day. Okay?
Oh, kasi minsan, 'di ba, parang okay, nagawa ko na, then the next day you don't have time. So you use the same one.
O,
Pero
diba?
na-contaminate na pala. So thank you, doctor. Really good tip dun sa mga nagdi-DIY and maybe if after consulting a doctor like yourself or you mismo, they can try that. I mean, you explain it so well already to our audience. I'm sure if somebody consulted you, you would be very, very thorough, and it would be completely, like, the information would completely be transferred to the patient. And then, okay, the other thing you mentioned that I'd like to touch on also, which is important for us non-medical professionals and us patients to know, is antibiotic resistance. Okay. That has been, I think, an ongoing issue for everyone in basically the world because before you could buy antibiotics over the counter. I kind of miss that. But
Before, Nicole, there are a lot of my patients who would come to me and they would tell me that they started already themselves with an antibiotic. And, syempre, hindi mo naman sila mapapagalitan. But I'm telling them to avoid doing those practices because, it's not cost-effective. And the more na umiinom sila ng antibiotic that it's not prescribed, the higher the resistant it will get. So, the higher form of antibiotics na kailangang ibigay sa kanila.
So number one, yung gastos mo, tas hindi mo pala kailangan, right, dun sa gamot. Tas pangalawa, okay, kasi when we've had this practice, I think it's much better now because people have been, people in medicine like you and others have been have campaigned in the past to an information campaign for people of why you shouldn't just take antibiotics without knowing. I mean, without really knowing or getting a consult from the doctor or, telling the doctor says, okay, you need to take antibiotics. And it's because we also had this practice of we take the antibiotic, then when we feel better, we stop.
Agree.
Lalo na before, the antibiotics were like, 21 days minsan, di ba? And then, when you stop, you don't realize that the antibiotic that you used, yung pag hindi mo tinapos yung dose, di ba, doctor, lumalakas kung sakaling maging resistant yung doon, yung bacteria.
Yes.
So, yun yung sinasabi mo, doc, na sige, nag-antibiotic ako, hindi mo pala kailangan. Tapos, parang nagkaroon na ng immunity dun sa antibiotic.
Yes, the bacteria. Kala natin ang mga bacteria walang utak, but they form resistance to antibiotics already, and that's bad, no?
So, pag hindi na nakuha yon ng antibiotic or may resistance na yung bacteria, ay baka ma-hospital ka, tapos kailangan higher dosage of antibiotic, higher, tas injection na rin. Have you ever seen that in your practice?
So far, sa ngayon, I haven't encountered anyone na nasal has sinusitis, but other forms of infection, yes. That we need to shift to another antibiotics and we need to culture it. Kung bakit siya hindi ko. Kasi you notice that the patient is not getting any better. Even if I'm giving empiric antibiotics already. So wala. Kumbaga, when we say empiric treatment, we give what is on the guidelines already. No? We follow the guidelines. Based on the guidelines, so ito yung common bacteria that's common, and with this antibiotic, dapat covered na. However, some patients of mine, even if I give the antibiotics after a week, minsan I extend it for 2 weeks,
Yes.
no improvement at all, and you would see na meron pa rin talagang discharge, then that's the time you get your culture already para makita mo kung what antibiotic na. And unfortunately, when we do cultures, the antibiotic that needs to be given is already in IV form. Kumbaga, wala siyang oral counterpart. So we tell the patients, admit kayo kasi kailangan yung antibiotic sa suero.
Pero, oo. And doctor, probably since you said so far, you haven't seen sa nasal, baka yun yung mga sore throat, ganun.
Yes.
Like that, oo. Kasi you also swab, di ba? To see if bacterial or viral. So, and those cases can get really serious. And masakit talaga yun. I mean, I know we're talking about sinusitis, but this is a side conversation that's related to it. Masakit yun. And syempre, magkaka-fever na rin and all of that. Kasi baka you're not taking the right antibiotic if you just pick and choose. And diba, doctor, there are different antibiotics that you would recommend for the throat. Different naman kung, let's say, the dentist sa ipin, ganun. So, okay. So, it's best to check with your ENT. Like Dr. Katindig here. Okay. So, doctor, when I asked you about the potential causes of sinusitis, is it really viral?
Most of the time, it's viral. Again, for acute sinusitis, by literature, they would tell us that it is viral in nature, most common. But again, we check the patient face to face. We really can say na talagang viral initially, no? Pwedeng viral, then hindi nag-i-improve, and it can be converted into a bacterial one. Now, for chronic sinusitis, when we say chronic, aside from bacterial infection, patient would have other immunological problems. No, minsan nga, we see patients with fungal or, fungal infections of the sinuses. So it can really happen, but we categorize it already to chronic sinusitis.
Okay. Doctor, thank you. Thank you for making that clear to us. We just need to take a short break. And when we come back, folks, I'm going to ask Doctor something sort of related to the DIY stuff and some of the practices now and why, why they don't do it. So, okay, Doctor, I know you're ready to answer that. And I know people my age and some people even younger and some older people, they have had this, when they've had sinusitis, they have this question, and sinusitis tuloy, sinusitis. They have this question pa rin. So I'll ask you the question right when we get back from our short break. Everybody stay tuned to Healthline with Makati Med. We have a great guest, Dr. Katindig. Very, very happy, very elevating vibes. And so stay tuned and we'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of Cubao. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, Cubao. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. Hi, this is Dr. 𝗛𝗶𝘁𝗵 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗠𝗸𝗁𝗵𝗹𝗁. Available for outpatient care services, our 𝗠𝗸𝗁𝗵𝗹𝗁 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗠𝗸𝗁𝗵𝗹𝗁 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗠𝗸𝗁𝗵𝗵𝗃 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗠𝗸𝗁𝗵𝗃.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, folks, thank you for tuning into Healthline with Makati Med, and welcome back. We're in the middle of our program, and we're talking about sinusitis, which is also, I guess, more prevalent at this time of the year, Doc, you would say?
Yes, actually.
Yeah.
Yes.
Okay. So, doctor, you've told us a lot about sinusitis. You've mentioned what sinuses are, and so it's not just a simple thing that's there in the nose. And you've told us the function, which is great. Like, it's there to protect your nose and your airways from. It has a mucus lining, and it's there to protect from bacteria that may get in. It's also there as a cushion, and it's kind of an amazing part of the body that it's filled with air, diba? So. I mean, I guess no other part of the body is really filled with air. Like parang, that's the thing that occupies it the most. So wait, I actually have a question about that later. But okay. So and this is a great show. I before we for me, because I'm getting so much information from you. Before we took a break, I said that I would ask something that's sort of related to DIY and the other things you said, because you've given us some ways on how to treat sinusitis. Like you said, like, okay, if it's viral and a patient sees you, you do encourage them to do self-care at home, which is hydrate with fluids, and maybe you can clean your nose with either something that's prepared already that's on the market, or you can clean it yourself. And then the other way is, like, if you discover that it's bacterial, you would probably give antibiotics, and we can get more into that in a bit. But I have to ask you, with the this is already related to how you treat sinusitis, and you gave us some of that. Are there any other ways that you treat sinusitis before I jump on you with my surprise question?
So yeah, when it comes to acute sinusitis, if it is plain viral infection, again, supportive medications. If it is bacterial, we give antibiotics. Now, it's a different management when it comes to chronic, since the patient has been having the symptoms more than 12 weeks already. Again, we need to identify the root cause on why the patient had this chronic sinusitis already. So again, there's a lot of diseases or a lot of comorbidities that can aggravate chronic sinusitis. Again, as I mentioned earlier, one is allergic rhinitis. Number two is asthma. If patient is asthmatic, there's a big chance that the patient also had chronic sinusitis as well. Now, patients who had chronic sinusitis, again, based on what I see here in the clinics, we check them if there's presence of polyps. So what
Okay.
is polyps? Polyps is a outgrowth of tissue inside your nose that causing the nasal stuffiness. But the problem with these polyps is that um, it can really cause discomfort and nasal congestion that at times you need to remove it surgically already. So aside from medical, there's some part of treatment that includes surgical surgery as well.
Could you describe the surgery to us just so that, people will get a better idea of it and they don't freak out now, oh my God, I need surgery on my nose. Yeah, you're not, that's not a plastic surgeon thing. This is for the polyps.
So, yun, the good thing nowadays is that the invention of endoscopes. So we do minimally invasive already, when it comes to nasal surgeries. Everything is intranasal. So wala kayong makikitang sugat outside the nose. We call the surgery functional endoscopic sinus surgery, wherein we open up all the sinuses, yung openings niya, we clean it and open it para makahinga ng maayos yung patient, no? Then we remove yung mga debris. Kung may nana doon, we remove it. Kung may fungal ball, we remove it. Kung may polyps, we remove it. Now, the problem lang with surgery, ako per se, or based on my experience, is I initially don't recommend doing surgery at first. Because I always make sure and explain to the patient that when it comes to chronic sinusitis, surgery is not really the go-to na treatment. Hindi siya yung pinakauna. We try to maximize medical treatment first. And then once na makita talaga natin na there's no improvement when it comes to to the patient's symptoms, then probably that's the time we can entertain surgery. But yung pinakaunang consult ninyo, don't worry. Hindi naman po agad surgery po agad yan. We need to work up, tingnan natin what's the main problem, and try medical treatment first before going to surgeries.
And of course, doctor, if it goes to surgery, this is an outpatient procedure. Like, I mean, you can find the patient.
Unfortunately, Nicole, no. When we do endoscopic sinus surgery, it is admitted. The patient will be admitted, and it will be under general anesthesia. No?
Okay, so general anesthesia would be you put the gas in the mouth.
The patient need to sit, yes.
Okay. I put the gas in the mouth. So, okay, so it's not an epidural or anything. It's not injected in your spine, but it's in a sense.
General anesthesia. It's under general anesthesia talaga.
So, okay, thank you for that, doctor. And as you said, you don't automatically go to surgery. That's sort of, in a way, the last thing that you would do to really help the patient. And especially if you discover things like polyps and then that will be necessary because we don't also want growths in our nose. Now, my surprise questions to you. Okay, do you still treat patients who have sinusitis and like their sinuses are filled? Because over the years, I think the practice before was, you would stick something up the nose and drain it. Do you still do that?
Well, we usually do suctioning at kumbaga, bedside, that procedure that we can do to alleviate the patients. They're, very clogged, and dami-dami nilang sipon. We usually do nasal suctioning at the bedside. And patient would find a little relief after doing the procedure that they, Doc, salamat, tinanggal mo lahat ng sipon sa loob ng ilong ko, no?
What do you mean by bedside? Like you don't do it in your office as a regular?
I mean, yes, we do it here at the clinic. We do
You
it.
do? Okay, so great. I'm sure get if a bunch of people I know find out about it, you might have a waiting list of patients. In terms of sinusitis, sorry, I have to refer to my own experience and other people who are close to me, their experiences. Over the years, they've said, I don't know why doctors don't suck out the sinuses, that's the mucus anymore, because it's really a relief. Although, of course, this was many years ago, like, they would stick something up your nose and then like say K, then it's like, you can hear it.
Suction it. Yeah, we still do it.
You'll do it. But after, it's such a relief. And then, you don't have to take antibiotics anymore. Then it seemed to be replaced by, no, we don't do that anymore. Not with you, of course, but with other ENTs. Like, no, we don't do that anymore. Let's look at your nose. I'll prescribe antibiotics, or because maybe it was bacterial, you know. So, so okay, that was my surprise question. Like, most of the time I hear, no, we don't do it anymore. But with you, you still do it. That's
So,
great. Okay, that's great. I know a bunch of people who will line up. You might better inform them. Because it's such a relief and you feel like you actually cleaned it. Okay. And then, before we proceed to other questions, doctor, can you tell us how to properly blow our nose?
okay. Well, when you say properly blow, I just tell them if you blow it, don't blow too hard. Kasi
Okay.
one possible complication is ear infection. If you
Oh,
blow it too hard, pwedeng pumunta yung sipon at the back of your ears, and that causes another problem that we don't want.
yeah.
And that's your acute otitis media. No? So that's one possible complications of your sinusitis and your rhinosinusitis. It's ear infection actually.
So, like, I guess, you know, for people, I think you've seen me blowing my nose during the break. So, I mean, I know people who, so many people who like wake up in the morning. It's probably an allergy, but first thing is blow your nose. Or, of course, when you have sinusitis, you're blowing your nose. And then maybe you can dispel some myths that we've heard, or, I mean, basically you said don't blow too hard, but like we've heard so many different instructions over the years of how to blow your nose properly. Like, just put it over your nose and then don't hold one nostril and blow. And then somebody will say, oh, okay, you hold the other nostril. But it feels more natural sometimes to hold. It depends on how someone blows their nose. So there's no exact prop.
Yes, wala talaga eh.
I guess if you really wanted to say that just don't blow your nose, pero tumutulo naman, mahirap.
Mhm.
As long as you don't blow hard. Too
Yes. Okay. You'll feel it eh. You'll feel it when you know that it's very hard because you hear a pop inside your ears already. When you
Yeah.
blow it up, may pop, ibig sabihin, malakas yung pagkasingamon mo.
Sumobra ka. Oo.
Yeah.
Sumobra ka. And then sometimes parang you can hear your own voice in your head. Yung when you're congested, then you're like, and then they're like, what? And then sometimes when you're congested, you can't hear yourself naman. So you're like, and they're like, oh, why are you shouting? But anyway, these are just some anecdotes, because a lot of people suffer from, you know, what nasal congestion in general. But sinusitis, it's really important to learn about it. I hear so many people say, I have sinusitis, but, you know, we're guilty of not going back to a doctor like you. Maybe we can treat it and, you know, try to get rid of it for good or manage it as best as possible. So, okay. So, doctor, you told us like the available treatment options for sinusitis, and you do encourage like, you know, to go through the steps, and surgery, you do that, but it's the last resort. And by the way, I'm so glad to hear, doctor, that your surgery is now, like,
Minimally invasive.
invasive. Oh, is this true? Maybe you can dispel a myth that everyone probably my age heard when people scared us, like, you know what? If you need an operation on your sinuses and you don't blow your nose properly, they're gonna cut it and then open the flap. So everyone's like, ah. But how
But
was it done before? It's so good to show the improvement. Go ahead, doctor.
we don't usually do it nowadays. Very seldom that we do it. But when we do it, ibig sabihin there's really punong-puno yung sinuses mo. We do sometimes, but the good thing about it is that it is done inside your mouth. We don't usually cut it outside. So still aesthetically, you won't see any scar outside your face. We do it and we open it inside the mouth. No?
Inside So you go through the roof of the mouth or something like
Yes.
that. Okay.
Yes.
That's great, doctor. And thanks for like, because, you know, we have like people who are scaring us, like they will cut your face open and spread it out. Then you will look like Joker afterward. So no need to worry
No
about
need for yes.
it. Thank you, doctor. Okay, so do you find that, can you tell us how sinusitis affects, like, is there a certain demographic or different age groups, like the younger people or perhaps children, then adults and the elderly? So let's
So
start. Yeah.
So for kids, no, the presentation of kids, the only difference is the possible presence of cough. So kids with sinusitis, no, the pediatric age group, they find it that pediatric patients tend to have cough also. Now, when you say cough, hindi naman siya prerequisite, but it can be present when pediatric patient have sinusitis.
Okay. All right. So for kids, it's not always present, but there can be a cough also. Is that because of like postnasal drip?
Yes, both because of the postnasal drip, no? Hindi pa sila marunong dumura eh. So
Mm.
they would tend to swallow and
Yeah.
then it will trigger the coughing.
Yeah. So yes, because kids like they don't parang they're still learning the process of spitting it out or even blowing their nose, 'di ba? Somebody has to help them blow their nose for them. Okay. For adults naman, doctor, what do you notice or what can you say about
For the adults again, so the same symptoms of nasal congestion, fullness, then yun nga, foul smelling, minsan may mabaho, at
Ah.
times because of smell, then facial pains. And then globally around 10 to 15% are affected with sinusitis actually. That is based again on the EPOS.
yeah. And then doctor, okay, just a question since we mentioned the foul smell and all of that. Yeah, when you think you have a cold sometimes or it's sinusitis or even an allergy, sometimes you're like sort of smells bulok inside my nose, right? Or
Yes.
and then, okay, can you tell us like kasi we've heard things like, oh, if the if what you're spitting or what's coming out of your nose is yellow, that's okay pa. If it's clear, it's okay pa. If it's green, that means you have an infection. Can you tell us what you think of
But
that?
not necessarily na yellow. Actually, yellow can indicate pus already. No? But
Yeah.
then again, that's the importance of seeking your healthcare professional, your doctors, is they verify if it is really bacterial. No, kasi usually if may discharge na, no, that's what we call it. If there's a discharge already, greenish or foul smelling na mabaho, more likely it's an indication of bacterial infection already. That's why you need an antibiotics for it probably.
Thank you, doctor. I mean, that's really helpful information because we have all these ideas as patients, no? Or as non-medical professionals. And yung parang, hindi, okay pa yan. I've heard that so many times. You don't need to go to the doctor kasi it's not yet green. But it could be pus. Basta kung medyo mabaho siya.
Yes. You go seek your doctor already.
Okay, thank you, doctor. And then when it comes to the elderly, do you notice, is it the same thing or are there differences?
They're still part of the adult part. But siguro the main difference with the elderly is that they're immunocompromised. Most of the time, elderly had other diseases such as diabetes in particular. That's why we need also to ask information about the control of their blood sugar as well, because it can really trigger, if they're meron ba silang maintenance, for example, that they're taking, for example, for yung mga asthmatic, if they're using any steroid inhalers that can aggravate your sinusitis if they're not using it well. No, I'm not saying naman all steroid inhalers can aggravate it, but there are some instances that patients do not follow their doctor's instructions. Usually, after your steroid inhalers, you gargle para hindi magkaroon ng fungal infection. Ano?
Okay, doctor. Yeah, no. Kasi if someone has rhinitis or allergy, some doctors or maybe you or the allergy doctor will prescribe a steroid inhaler.
Yes.
I know you don't want to name brand names, but there's like fluticasone am I saying it correct? Propionate, but I don't think that's the brand name. But some patients are made to like pump it, inhale once a day, diba? Then after that, you recommend that they do gargle also.
Okay. The difference, Nicole, the nasal steroid spray, that's what you're mentioning, the intranasal steroid spray, the difference with the oral for the asthma that I'm talking about earlier, they're different in terms of dosing. Mas malakas kasi ang dose ni oral kaysa sa spray nasal. So in terms of possible side effect of any problems that you can encounter using intranasal steroid spray, mababa naman. The only problem by literature that you can see is possible nose bleeding
Okay.
because of improper use of the device. But in terms of fungal infection, not really. Actually, it's recommended that you start your intranasal corticosteroid spray if you have acute rhinitis or chronic rhinosinusitis. Actually, it's part of the treatment regimen also.
Okay, that's great, doctor. You differentiated between the two, because like if it's a nasal steroid, hardly any problems, but the dose of the oral is stronger. And with the nasal steroids, as you said, sometimes it's nose bleeding because of improper use. Like, I don't go. Maybe when you push the inhaler, don't do anything else, just that. Don't
Yeah.
be running after a
Yeah.
oh, I forgot to kneel. Shh. Well, while you're running, then back,
Yeah.
Of course, that's an extreme example, but, sometimes, you just like, okay, when you take your meds, like, okay, focus on that. Only takes less than a minute. And then, I've seen some people who are sick, and then you're like, can you wash the cap? Because it's removable. For the oral naman, yes, I've seen that there. I mean, there are different kinds. No, there's some are the ones that for those who have asthma, there's kind of like a pill in it, and then you turn it around and you
Yes,
break that,
exactly.
and then you have to inhale it. And there are those that you just pump.
Oh.
Like, okay, I won't be able to the the generic name right now. So I just have to say the brand name, okay? I'm not endorsing anyone, and neither using Ventolin, di ba? Like, you pump it. And yeah, that can affect it's going to your mouth. It hits your tonsil, your
Yes.
throat. And sometimes I wonder, does it really get to your lungs?
That's why you need to follow the instruction of your pulmonologist. Actually, the inhalers do, the pulmonologist will give you an instruction how to properly use it.
Like, hold your breath,
Yes.
60 seconds, and yeah, that kind of thing.
Alam mo na pala, Nicole.
Everyone around me, including marami kang pasyente, doc. Okay. And then, so, okay, thank you, doctor, for clearing that up, because, even how to blow your nose, you told us just as long as you don't blow too hard. Maraming questions na ganyan, yung mga basic lang, hindi namin alam, hindi kami sigurado. So thank you for clearing that up for all of us. And then, okay, since we have mentioned that, it's the season for it, ganun, how does the holiday season impact people? Have you seen, like, getting more cases of sinusitis?
Okay. So again, because of the changes in weather, mas malamig na ngayon yung panahon. Actually, it's very kakaiba nga ngayon. From minsan init, lalamig. No, these season changes really affects the patient who had allergic rhinitis. Again, I will go back. No, that's why I'm telling you that interrelated si allergic rhinitis together with your sinusitis, and those comorbidities that patient had needs to be treated para maiwasan natin yung impact ng sinusitis, because one complications of allergic rhinitis can be really sinusitis. No, if it causes the engorgement of your lining of your sinuses together with your nose, that causes the immobility of your mucus to get out. That's why nagkakaroon ka ng inflamed sinus after a while.
So, and basically, like, thank you for reminding us of the comorbidities and the other conditions, because it's, as you said, it's interrelated. Baka if you don't follow instructions from doctors like you, or your doctors treating your allergy, then, you can't just blow it out. Sometimes you could use some help.
Yeah.
And then you're like, okay. So, okay, thank you, doctor. And then also, well, it's the weather. No, you said it's the weather also. At this time of the year, where we are, the weather changes. For some people in other parts of the world, it doesn't seem like a drastic change, right? Because they have like,
They're used to it.
yeah, and then they have they have 4 seasons, and then like it gets really cold. Like we don't get the snow and the super stinging wind here, but of course, I've tried that and all of that. But for us here, who are living here, there's still a change in weather. And as you said, kakaiba yung weather ngayon in this particular season, no? You were saying init ulan. So, have you gotten more patients because of the init ulan thing?
Actually, in fact, it all started actually, Nicole, if I am correct, since end of October.
Mm-mm.
Everything started drastically, simpleng cough, yung ubo, yan. Tapos sisiponin na rin sila. Grabe yung sipon talaga ng patients nitong panahon na to. It's really bad, no? Lalo na ngayon, even tumataas din ang cases of COVID. It's really there in the news that COVID cases are increasing again. So that's why it's important na, we protect ourselves by wearing face masks pa din, do your regular hand washing pa din, you protect yourselves pa rin.
Yes, doctor, thank you for reminding us of that. And it's not about it. I mean, it's a fact. The cases of COVID are increasing. It's there in the news. It's not you who put it. It's just there, and you're reminding us. And thank you, kasi I also noticed that a lot of people I know started getting sick end of October. Yung parang something that has to do with like a cough or parang sobrang na allergy yung ilong or that kind of thing. And so probably even small changes lang in weather. Like some people in other parts of the world would laugh at us like, what? You got colder by 1 or 2 degrees? Ha 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 ha. But for us here who are exposed, it's different already. It feels different. And asthmatics feel it too, di ba, Doc? Like, they can, sometimes, I know a lot of asthmatics are like, it's gonna rain. Kasi iba yung pakiramdam nila. And we have been getting like rain, and then suddenly it's so hot, the sun is out, and then there are days when, oh, it feels a little cooler, but you're still in hell. You're still burning in hell, but it feels a little cooler. Maybe we're in right now. And then the next day, oh, it's hell again. That kind of feeling. So I would imagine that would wreak havoc on people who have allergies, sinusitis, and all sorts of other things. And the exposure, no? Okay, doctor. Are there specific activities or environmental, environmental causes or that can cause more cases, or environmental factors actually that can cause more cases of sinusitis during the holidays?
Okay, one factor could be smoking. So if you're exposed or if you're not actively or even you're passive smoking, you're being affected, it can actually aggravate your sinusitis. So yung mga nagsisiga outside, we don't really practice it anymore. We don't encourage people, lalo na sa mga probinsya na nagsisiga pa sa labas, yung mga kalat sa dumi, nagsisiga. So we don't usually encourage them na magsiga pa, no? So yun, smoking and yung pagsisiga, one factor yun.
One factor. Thank you, doctor. At saka, that's very, in our culture, that's common, and they still do it a lot in the provinces, even in some areas of the metro. Siga. For those watching abroad who are not, really familiar with our culture, it's like we have our dried leaves and sometimes trash, and kung ano-ano na. Sometimes there's rubber, like, and then we burn it. Yeah, we burn it because that's the way we used to get rid of them, But yes, for a long time, people have been discouraging that. And like in some places, you're not allowed to do that. Like in some villages or areas, you're not. But you still smell it. It still happens. I mean, even if you live in a place where it doesn't happen, you could be right beside another place that allows it. Saka sa mga probinsya, nagsisiga pa rin. It's just that they have more space so you can kind of avoid it. Pero kung naamoy mo yung smoke sa siga, pwede mag-trigger yun. Doc. Tsaka yung paninigarilyo. What about vaping? Since we're in...
That's another form din of fume. So we don't encourage din even vaping, no? That's a type of fume na lumalabas pa rin. So we discourage patients to use it also.
How about electronic cigarettes na not vaping but you know,
Same.
same.
Same thing, no? So basta anything that can, cause discomfort and smoke and trigger your sinuses, yung ilong mo, so
Yeah.
we discourage using it.
So cigarettes, cigars, vaping, electronic cigarettes can trigger it at this time of the year. Okay. I mean, any time of the year actually. Pero
Anytime yun, actually. Yeah, that's correct. Any time of the year.
actually, doctor, I guess in some, do you think it also has to do with okay, like are there specific activities aside from that you know, at this time of the year make the patients or people prone to sinusitis more exposed to, let's say, smoke or other things that would trigger their
Isa pa pala, yes. This new year, for example, this holiday, yung mga paputok.
yes.
So isa pang factor yon that can trigger your sinusitis. So try to avoid yung paputok din because of the smoke. Isa pa pala is yung kunyari if you're fond of cooking, yung tawag dito, yung roast, naglelechon kayo sa bahay. Minsan kasi may iba na naglelechon sa backyard nila. So isa pa rin.
Yung with the
The usap of the
type of smoke, usok, yeah. And sometimes when we're cooking more this time of the year, so if your kitchen isn't well ventilated, you're
agree. Yes.
okay. Doctor, before we proceed, we just have to take a short break, but people stay tuned because there's more coming from Dr. Katindig, Dr. Paulo Katindig. We're talking about sinusitis, very relevant for this time of the year. We just need a short break to remind you of important things, and we'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
If you like listening to our stations, DZRJ 810 AM and RJFM 100.3, there's no excuse not to listen anywhere and wherever you want. Listen on your phone or computer anytime, anywhere in the world. Just download the app for free. How do you download? If you have an Android phone or tablet, go to Google Play Store. If you have an iPhone or iPad, go to Apple App Store. It's that simple. We have 3 streaming sites. Just type in TuneIn Radio or Radio Garden or Streema. That's STREEMA. Once the app is downloaded, type in and search for DZRJ. And now you can choose and enjoy DZRJ 810 AM and RJFM 100.3 anytime and anywhere. Hey, it's free.
Ho, 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 ho. Merry Christmas. We wish you a Merry Christmas. We have a Christmas treat for you at Bistro RJ. Merry Christmas, RJ here. You know, every year we have a Christmas treat at Bistro RJ. And this year, we'll have a Legends Christmas treat. 2 shows in one night, back to back. Legends Night and all-night dancing. The legends that will be singing Christmas songs from the legends. Elvis will be there in the person of Bam Ang Ping, young Elvis sensation, now a little older. Dean Martin, portrayed by Douglas Masuda. Johnny Cash to be portrayed by 18-year-old David Young. Brenda Lee will be portrayed by Genevieve Laksamana. Mariah Carey to be portrayed by Yen Victoria. And Michael Bublé to be portrayed by Arch Smith. And I, RJ, will portray the Beach Boys. That's 7 artists in one night. Don't miss the Christmas treat of Bistro RJ this year. December 22, 2 shows in one night, 8 p.m. Friday, RJ Bistro Dusitani Hotel. Entrance is 1,000 pesos. For inquiries and reservations, reserve now. Call 0906-221-1524 right now. Or visit us at facebook.com/RJ Bistro. Merry Christmas, everybody. Let's be happy. It's Christmas season. Bistro RJ brings you happiness all the way.
RJ Network celebrates 60 years of service and rock and roll on RJ Digi TV, Radio Bandido TV, Rock of Manila TV, RJFM, Mega Manila, Cebu and Davao on 100.3, Bacolod 99.9, Cagayan de Oro 88.5, Iloilo 98.3, Tuguegarao 96.5, Puerto Princesa Palawan 99.1, Baguio 91.1, and Iligan 88.7. We thank you for tuning in and watching us in the Philippines and online from around the world.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Okay, welcome back to Healthline with Makati Med. And just like the station, I'd like to wish you all a happy season. You don't, for me, you don't have to be like over the top celebrating as long as you're happy, you're relaxed, and you're healthy. And that's Merry Christmas to you guys from Healthline with Makati Med. Of course, the doctors are concerned about your health, like Dr. Paolo Catindig here, and the other doctors also whom we have interviewed over the holiday season. So, stay healthy and maraming salamat sa inyong pagtatangkilik sa lahat ng programa ng stasyon na to, pati na rin sa Healthline sa Makati Med. Okay, so doctor, we were talking about some triggers or environmental factors that can worsen a case of sinusitis, or maybe like have a patient get a flare up. You did mention smoke, and any type of smoking, basta may usok, the even siga, even cooking, and then like roasting in your back. That happens, yes, it happens a lot. And then even grilling, anything with smoke. Can I ask you, how about, this is like a personal question actually. How about perfume? Because I really don't, parang, when the perfume is too strong smelling, can that actually trigger something? Or is it just because my personal preference is like, bleh,
No naman. So again, as I mentioned earlier, if you have allergic rhinitis, that all boils down to your triggers. So if the patient had a particular trigger to this particular allergen, it can actually aggravate it. So some patients would have triggers with perfume, yung strong smell, not perfume per se, but some strong smell can trigger it. Some naman would be triggered by animal danders, yung mga alaga nilang hayop sa bahay. By literature, most common talaga yan animal danders, house dust mites, and smoking. Those are possible triggers pa rin talaga, both for allergic rhinitis and sinusitis.
And then, so anything that irritates you, like if the smell of alcohol or no brand names, mag-sponsor kayo, hindi lang. yung mga things we use to clean the house or soap, that's anything can also sort of lead to that. I mean, worsen the sinusitis. Okay, thank you, doctor. Okay, so what advice would you give people who have sinusitis or having flare-ups, who want to enjoy the holiday festivities without their symptoms worsening? Kasi we have a lot of like reunions, parties, whatever it is, there's a lot of gathering. So what advice would you give people who still want to participate in these gatherings and go to reunions or whatever it is and be around a lot of people?
So again, sabi ko nga, it's always, prevention is always better than cure. So we need, to prevent things to happen. And by preventing, you avoid complications such as sinusitis. So preventive measures can be one, hydrate, keep yourself hydrated always. To make your mucus functional, instead of na maging malapot, nagiging mas malabnaw kasi when you hydrate. And you keep yourself, you give yourself a boost of your vitamins. Vitamin C in particular, to keep your immune system healthy always, para lagi kang, stay fit and healthy. Then rest, enough rest, Hindi naman ibig sabihin, for example, for this holiday season, I know na kaliwat kanan ang parties at inaabot ng madaling araw, So you need yourself to recuperate at kailangan mong magpahinga din, So sa trabaho, wag din sagad-sagaran. I know na kailangan nating magtrabaho because it's the holiday season and kailangan natin. But again, you need to rest, recuperate in order for your body to recuperate. Then prevention is, keep your lagi pa rin proper hand washing. Minsan kasi because they say that COVID is over, we forget those little things that prevents us from getting sick. So like simple hand washing, at times when we're joking na nga this last Christmas, wala nang may baong alcohol sa inyo. Before, kanya-kanya, isa-isa, may mga daladalang alcohol. But, we notice it that at times we forget, the proper hand washing technique, or at least, keep things sanitized. You spray it with alcohol. You still bring your face mask. Then, if you know that you're sick, don't come to gatherings anymore. Diba? Yun lang yung sinasabi. As much as possible that syempre you want to join the festivities, you want to be happy, but keeping others and your loved ones safe is better also. So, kumbaga, wear face mask. If you really wanted to go, then wear face mask, to protect them, Yun.
Thank you, doctor. That's so important also that people know that if you are sick, the more you should wear a face mask if you have to be exposed to other people, because you can infect them.
Yes.
And
Sabi ko nga, hindi na kinakahiya yun ng pagsusuot ng face mask, because some would say it's a stigma. Arte-arte, may pa-face mask na. I think because of the past 3 years that we've been through with COVID, I think we should get used to it. It's in the lifestyle already. It's in our lifestyle.
I agree with you, doctor, that things have changed. I mean, sorry, but things have changed. And sometimes, of course, people wanted to go back to before where you didn't have to be so careful. But, well, that's not reality. Right? Things have changed. And also, if you care about people, I mean, you wouldn't want someone visiting you and then not wearing a face mask and then someone in your family gets sick. Diba? Kasi nabigay mo sa kanila or nabigay niya sa kanila, may seniors din tayo, and, may comorbidity sila. So thank you for that reminder, doctor. That's really so important these days. And you did also mention, get some rest, don't overwork yourself when it comes to work. At saka, maybe people want to attend everything because they felt, closed off, but it's not gonna do you any good if you're tired and your immunity goes down and then you get sick. Kasi there's a lot of iba pati yung if you're commuting or even if you're driving in a car, doctor, you get stuck in traffic. Tapos yung exhaust, minsan naamoy mo pa rin, di ba? So thank you, doctor, for reminding people na we don't have to overdo it this season. But for those traveling, doctor, they need to travel to visit relatives or whatever it is during this holiday season. What tips can you give those who are traveling, especially by air? Or let's say by air and sea and land.
The problem with airplanes is that it's really enclosed, no? So the air that's circulating inside the airplane is the one that's breathing. Yung sinong may sakit, you're breathing it in also. So as much as possible, again, wear face mask. There's nothing wrong with wearing face masks, para lang na protectionan mo rin yung sarili mo. And then, sabi ko nga, if you're sick, wear face mask pa din. This is just to protect others. Uso na naman talaga not only flu but COVID. It's really there. Kaya nga, you mentioned that's reality. And reality that COVID is still there. Hindi siya nawala. Andyan pa rin siya.
And then, doctor, I traveled about a month ago by air, and I noticed that people are totally not wearing masks. It's within the airplane, and because as you said, the air circulates. So one way to protect yourself is doing that. Go to the bathroom, wash your hands. Then you start freaking out. Oh my God, who touched this? And you wash that in the faucet still, and then you have your baon of alcohol, especially when you travel. And how about the air pressure? Does it can affect our ears? Does it also affect sinus?
For the if you have nasal symptoms, you have difficulty equalizing it. That's the problem. So at times, if you have sinusitis, so pagka meron kang sipon, yan ang problema. Pwede talagang magkaroon ng ear problem then. You have difficulty equalizing that you feel pressure inside your ears.
Siyempre, okay. But if we have to travel by air, at least you have warned us already and told us of of what we have to do. And siguro hindi na masyado mag-freak out. Don't be surprised. If you feel that pressure, don't blow too hard. Kasi that's the temptation when you fly, di ba, doctor? Yung, and then you're like, then you're like, okay, I think I busted my eardrum. Then I'd have to see you for a busted eardrum.
You can actually chew some gum. It can help. While para, to open up and close your eustachian tube to equalize it. Or you yawn instead of blowing your instead of popping it, you yawn. You yawn or you chew some gum. It might help.
I actually yawn. Yeah, and oh my God, when you talk about yawning, you feel like yawning now, no? Feel like yawning now, no? No. Just hearing, I know you guys are watching, suddenly went, and yawned. I don't know what it is. I think that's something that it's a human experience. When you just think of someone yawning, you're like, ah. Okay. Doctor, are there certain holiday foods or beverages that can aggravate sinusitis? And do you have any dietary recommendations for the season? Because we're eating a lot of different types of food now and drinking stuff.
No dietary restrictions when it comes to sinusitis naman. You can eat anything. That's a good thing about sinusitis. No? Except if you have complications of tonsillitis already. So, kumbaga, if you have pharyngitis or tonsillitis because of your sinuses or your rhinitis, at times patient would complain, Doc, may sipon ako. It all started with just simple sinusitis, then all of a sudden, Doc, sumasakit na yung lalamunan ko. So if ever you experience those things, then best to, again, self-remedy can be gargling. You drink a lot of fluids, you gargle. What available brand you had at home, any mouthwash or gargles that you had, gargle it. There's nothing wrong with it. Then if there's progression, pain, when you swallow, then go consult your preferred doctor.
Do you still advise gargling with warm water?
Yes, and salt. Yes.
Okay.
It's not effective naman.
Yes. It does comfort you after you gargle. First, it's like, it hurts. And then after, you're okay. I mean, it feels better somehow, no? And then we have things also in our culture where pinapatak ka ng kalamansi, yung ganun. What do you think of those remedies?
Well, calamansi naman is citrus, and citrus is a good source of vitamin C. So I will not tell that it's bad. Yun nga lang, minsan yung over, at times patient would have acid reflux. Magiging problem with calamansi naman. But overall, it's pretty safe since it's natural naman.
Thank you, doctor. You're so game in answering all my questions, and you just like things that I'm thinking of pulling out of the air, because many people who have this experience of either allergic rhinitis and or sinusitis and who are prone to getting tonsillitis, which you treat. I mean, all the questions are parang they're all sometimes interrelated, and we already just assume things. Because we get it. At least you're clearing it all up for us. And Doc, I have a question. Okay. If you think you have sinusitis, or let's say when you were a kid, you had sinusitis at a certain time of your life, a lot of people get lazy to go to the doctor. Can that lead to something very serious or aggravated? Like if you're just dealing with it on your own and not going to the doctor because you feel like you're so used to it, kaya mo naman?
My mantra, Nicole, is that no news is always a good news. So if it doesn't come back to me, so I assume that they are okay, that they don't feel anything. Now, ako lagi kong sinasabi that I empower my patients. I share the knowledge, and I share them on how to manage then yung kanilang symptoms at home. Syempre, we don't want naman that every time that they would have the same symptoms, they would come to me and they will tell me, Doc, you're giving me naman the same prescription every now and then. That's why I'm telling them and empowering my patients that if you have these symptoms, okay, you can try the medications first. But if you feel that your symptoms is not getting better and it's getting worse, then you come back to me. But otherwise, if your symptoms is controlled by just, the medication that I gave you that you can buy over the counter, then it's fine with me. Okay? You don't need to come to me.
You don't have to come to me. Okay. Doctor. And then I have a question just about the medication that you prescribed. I mean, no brand names or whatever here, but when you say decongestants, there are different kinds, right? There's some that
There's this spray. there's what we call the spray, and then the oral forms. Now, I always tell my patients that you do not overuse it. There's what we call rebound congestion for patients who use prolonged decongestants because there are some patients of mine who are overused naman na sobrang nagagamit dahil sanay na nga sila and they're used to their symptoms. They're used to using the same medications. That's why I'm telling them, oh, don't overuse. If you feel that if you use the medications for 1 week already and you don't feel any relief at all, don't continue using it. You come to me so we can check what's the problem already. Because there might be other problems aside from your regular rhinitis that's causing the problem already. So yun lang ang lagi kong bilin. So if you have the symptoms, then 1 week of treatment, no improvement, worsening, go to your doctor.
Doctor, I'm glad you said that kasi may kilala ako, hindi ako yun, talagang kilala ko. Kasi umiinom siya nung decongestant. Pero parang naging araw-araw na. So sabi ko, baka naman allergy na yan. Kasi yun yung kailangan mo na klaseng decongestant. Kasi parang di gumagana, di ba, over time. And then, when you say decongestants, doctor, do you also prescribe like decongestants? Like we know that some allergy medication, medication made to target allergy can also be used as decongestants. Do you ever do that, or do you know patients who do that?
Okay. So currently in the market here in the Philippines, the one that is available, the tablet form, contains both decongestant and antihistamines already.
Okay.
So there's some medications that's available na one tablet has it all already.
I'll have to find out what that is. Okay. Okay, thank you, doctor. Thank you so much for all the information you gave us today. And then perhaps also, like, I have a question. Does drinking alcohol can it aggravate your sinusitis?
Well, sabi ko nga, no food restrictions when it comes to sinusitis, no? But I always tell my patients to drink and eat in moderation. Hindi ko naman ibig sabihin sabi ni Doc, wala daw palang problema eh. I always tell them, you drink in moderation. Huwag sagarin. You know, sinabi nating drinking lang na paunti-unti, it's okay. Huwag lang sagad-sagaran.
Tsaka madi-dehydrate ka rin nun, Doc.
Yes.
May sinusitis ka na, may hangover ka pa. Okay, thank you, doctor. Do you have any advice for individuals prone to recurrent sinusitis episodes, or anything you'd like to say about the topic, or even beyond sinusitis as an ENT and a great guest on the program the week before Christmas? Can you just, I'll give you the floor.
Okay. So again, to everyone, I would like to reiterate the importance of prevention when it comes to sinusitis. So again, you rest, take your vitamins, hydrate. Then if you're sick, wear face masks. Don't forget yung paghuhugas pa rin talaga ng kamay. Alcohol, bring it. Now, if you have history of allergic rhinitis, make sure to go to your doctor or ask your physician about how to manage and control your symptoms to prevent further aggravation of your sinusitis. Now, for those patients who had sinusitis and who experienced sinusitis, you know the difference between sinusitis and allergic rhinitis. So, you know it very well. So, for everyone's information, to differentiate between allergic rhinitis and acute sinusitis, if you had fever, facial pains, more likely it's acute sinusitis. If wala, nasal congestion lang, baradong ilong, sneezing episodes, more likely that's allergic.
That's great, doctor. Then that's a great way of telling us how to differentiate.
Okay.
Sorry, interrupt. More.
So,
More.
So basically, that's it. I hope you all enjoy the holidays. Keep it safe, and let's all be merry this holiday season.
Thank you, doctor, and thank you for reminding us to rest. Sometimes I feel that we're so used to being told by whatever it is in our society that if we don't move around or feel like we're, exhausting ourselves with work or whatever it is, then we're not contributing or we're not valuable. And bodies, minds, souls need to rest also.
Agree.
Work smarter, not hard, not necessarily work.
Agree.
Is there anyone you want to greet, Doctor, before we end the show for today?
I would like to take this opportunity, to thank the Department of ENT, in particular of Makati Medical Center, for allowing me to be the guest here. Thank you, Nicole, for having me for tonight and, sharing this in my professional expertise to our listeners this evening.
Thank you for being part of the show, for agreeing to be part of the show, and for sharing your knowledge and expertise, and for being, actually, you're very, uplifting. Like, you're like, hey, it's almost Christmas and doctor's here to help us. And people might think, well, that's just sinusitis. But you know what? A lot of us have it. And we also have allergies and other things that Dr. Paulo Catindig is used to treating and seeing. ENT, so ears, nose, throat. Thank you so much for being on the program today, Doctor.
Very much, Nicole, also.
And thank you for sharing your time and your effort. It really means a lot to me, and I'm sure it means a lot to the viewers, especially those who have sinusitis and who have maybe other problems that are interrelated that you touched on. Thank you, Doctor.
Thank you, Nicole.
Okay. So, folks, next week, we do have a new show for you, with different content, not a replay. Remember Christmas Day and New Year's Day. We have shows for you from Healthline for Makati Med. Thank you for tuning in. Thank you for staying tuned. Maraming salamat, and advance Merry Christmas sa inyong lahat. Bye, Doctor. Bye. Take care, everybody. See you next time.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts